I think we will go ahead and get started. Good afternoon, everyone. My name is John Garfalo. I am the Vice President of Community Investment for your Akron Community Foundation. We would like to welcome you to this quarter's community issue session. And we thank our guests who are going to be here to present a little later. Also want to thank members of our board, as well as our Community Investment Committee, who are also on the line today, who are going to be instrumental in reviewing our 68 applications we received for Health and Human Services grants, totaling a little over $1.1 million for us to make decisions on what we're going to distribute out in the community. So thank you to our committee members and board members who are here with us today, including our president of our board, Sylvia Trundle, our president and CEO of the organization, John Paturis, as well as our community investment chair, Doug Kaczynski. Before we begin, just wanted to give you three reminders. One is if you have not had a chance to review our Polsky retrospective that we did about 2 weeks ago, we encourage you to go onto our website and review that. It gives you a great historical perspective of philanthropy here in Summit County, especially with some of those more distinguished Polsky winners who have won that award over the past few years. So if you haven't had a chance to review that, I encourage you to do so. You'll be happy you did. Second, a reminder that our Women's Endowment Fund is accepting grant applications for programs that benefit women and girls here in our community. Those applications are due on November 1st, sorry, my bad. And you have until 11:59 November 1st to get those in. And then finally, our Summit County Opiate Healing Fund will be accepting applications again, starting in mid-November, all the way through December 9th. And if you have any questions about that process, please make sure you reach out to myself or my colleague, Brian Wrights, who is on the line here, our agency endowment engagement officer at the foundation, who will help you through that process. So with that, I will turn it over to my colleague, Cristina Gonzalez Alcala, who will introduce our speakers.
Thank you, John. It is my pleasure to introduce our guests for today's community issue session. Please feel free to send some love to them after I introduce them via the chat. It is open. Our first speaker today is Donna Skoda, our Summit County Public Health Commissioner. Our second speaker will be Christine Curry, Chief Executive Officer at OpenM. And our third speaker today is Stephen McGarity, Executive Director at Community Legal Aid. Again, the chat is open, and so is the Q&A for you to submit your questions for our speakers. We thank you all for being here, and especially our panelists for joining us. And Donna, you have the virtual floor. Take it away.
All right, thank you very much. Good afternoon, everyone. I appreciate the opportunity to come and share some insights from what we've learned over the last, seems like forever, but 18 months, I guess it really is. So I'm going to start out with just some sort of very high level sort of numbers to put it in perspective for you. And then we can take it from there. When you look across the world, and we had a pandemic. It wasn't just at the shores of the United States. It began in China and Europe, came here. By March, we had pretty much determined that yes, in fact, COVID-19 was the product of SARS-CoV-2, and it was circulating among the populations, and that we had a novel virus, and that and many of you may remember SARS-CoV-1 was like 08 or 05, 08, and it came and went. It came, there was like 38 cases in the United States related to travel. There may have been 500 in the entire United States. It was very, very short-lived, and it just moved on. And we also had MERS, which is another coronavirus that was very short-lived as well. This one, however, has taken a very different approach and has maintained and continued to hang and stay during all kinds of weather, all times of seasonal weather, and just tends to hang on, affecting different age groups. So let me start back in March and just sort of lay this the stage for where we were. When COVID came, it was a novel coronavirus causing a disease of COVID-19. At that time, we had very limited testing availability. It was a worldwide pandemic. So who knew that all of the swabs we needed were made in China? I mean, who knew the reagents came from Italy or I mean, it really did have a global economic impact of not being able to get supplies to do adequate testing. Well, the way you contain disease, any disease, is to actually, you have to do the testing. You have to find out who has the disease. You have to isolate the sick, and you have to quarantine those that are exposed. And those are old public health. I mean, very old public health strategies that have been around for years. And unbeknownst to most people, local public health departments work every day to make sure that we don't have spread of disease. I mean, every day we're working with TB patients, their families, we're doing contact tracing, we're making sure that we don't have another outbreak of tuberculosis. We also do other diseases as well, HIV, hepatitis A, B, and C. And so we work continually with the community and persons. Well, COVID was on a whole other scale. When COVID hit, contact tracing became a profession. We needed lots and lots of people to handle the cases. Now, across the United States, we've had approximately about 700 deaths in about 18 months. A really bad flu year is somewhere around 36,000 deaths. So you can see the absolute magnitude of what this has done. In Summit County, since the beginning, we have had about 65,000 cases of COVID-19, and unfortunately have had about 1,300 deaths. So with everything in turmoil and not really understanding all of the nuances, it was very necessary to reach out to partners. Our hospitals were partners, our county, EMA, our cities, villages, and townships. All of our partners that worked together with us worked because everybody had a little piece of the puzzle. And we had to really try to do and move as quickly as possible to contain this virus. One of the biggest problems, though, is you have an airborne virus that has a 14-day incubation period. And when you have that situation, and it's fairly contagious, and every strain of COVID that has evolved since the original ancestral strain has been more contagious. So COVID has figured out a way to change so that it's able to continue to spread. And our hope was, if we can do the testing, the isolation, the quarantine, if we can keep people away from each other, wear a mask, employ public health strategies until we can get a vaccine developed. And we were very hopeful that the vaccine would mean that we could clearly start seeing our way out of this pandemic. When we look, though, across, the pandemic brought out more than disease. It clearly, public health, was obviously trying to do the best they could with the state leaders, the local leaders, government, trying to do everything we could to contain this disease. But honestly, it brought out a lot of inequity in our world. I can honestly tell you that we left a generation of people behind, even just trying to connect with folks, trying to connect with individuals to get either technology, to get people signed up, to get individuals to be able to be in touch with us, was very difficult because not everybody has the technological access that is necessary to survive in this world. It's very difficult with MyChart. Go online, register for a test, go online, get an appointment. And that was very, very difficult to get that done for people. We had call centers, we had people redeployed in their jobs, 30 people doing nothing but phone calls, calling people, trying to reach out to the elderly, minority communities, trying to make sure we could make contact with folks and get them to either be tested, isolate, or quarantined during this time. And I want to talk just a minute, when we look at the racial divide around COVID-19, it pretty much aligns with what Summit County is racially. We have about 12% of our cases were African American, about 4% were Asian, about 50% were white. But there's a significant portion. We aren't the only ones to test and collect information. So not always is race collected if the test is run somewhere else. We made a diligent effort to always collect race and to collect any number of data points, but not everybody does that. So we have about 10% of our cases that are unknown. And actually, there were less males affected. There were only about 42% of the males as compared to around 50% of females that were affected with COVID-19. So it was interesting to see that. Now, if you think back again to when this all started, nursing homes, congregate living settings were very hard hit. And that's because one of the things that it brought out when I talked about this inequity, and this is what I want to point out, it isn't always just whether you're African American or not. It's a situation that you've been surviving in. We found very quickly that many of these individuals were working 2 or 3 jobs just to survive. They would get a day at this nursing home, a day at that nursing home, 2 days at this nursing home. And they were literally going from nursing home to try to make enough money to survive. Well, with it, they were bringing COVID, unknowns to them. So they were going around populating and COVID was being spread. Now, think about the nursing home environment. It's a long-term care congregate living setting. We know that any airborne respiratory virus is extremely dangerous in a congregate living setting. So what we had was a perfect storm. We had people, or multiple people, coming in from the outside, individuals working with patients, going to the next nursing home and the next nursing home. And before you knew it, we were actually having many cases pop up in the nursing home. And unfortunately, the elderly are very vulnerable. And unfortunately, it took way too many lives. We had 1,300 deaths in Summit County. And our average age when we started was somewhere around 60 some years, 70 years. It is now down to about 45 years. So we have seen a significant drop in our average age, simply because of this COVID Delta that is now circulating. So let's talk a minute just about what happens. And then I didn't really mention that we had about 10% of all our cases hospitalized. And we also had another 12% of our cases that were asymptomatic. So these were people that didn't even know they had COVID walking around and got a test because somebody made them or they had a sniffle. So we're finding that it was very difficult to keep this virus contained. Let's talk now about where we're headed as far as what's happening. We know that masks work. We know that public health measures work. However, we have a society that has a lot of COVID fatigue. It has been very difficult to be isolated, to be separated. We have tried desperately to convey the messages that we really need to keep working for each other, protecting each other, but it is difficult. And then lo and behold, by the end of 2020, we had a vaccine. And if you remember correctly, it started with the most at-risk groups. It started with long-term care. It started with firefighters, EMS personnel. It also went to congregate living sites for individuals that lived in group homes, DD, ADM, places where folks would be most vulnerable. That's what we were charged with vaccinating first. And not to mention that there were not enough vaccine to go around. So it really, again, the perfect storm where we were trying to vaccinate folks, trying to get people to get the shots. And then lo and behold, we didn't have enough vaccine either. Well, we continued to push ahead, vaccinating everybody that was willing, communities, contracting with SUMA and others to try to help us reach more communities. We did priority scheduling through community centers and desperately tried to get as many people vaccinated as possible. And during, and I should probably say this, during any given year, only about 50% of the people get a flu shot. It just seems to be one of those things you do or you didn't do. And only about 50% get a flu shot, but in reality, everybody should have a COVID shot and everybody should have a flu shot. So it's not unusual that we have struggled to keep increasing our percentage of vaccine since we hit that 50% mark. And when you hit that 50% mark, is when you really have to start wondering, how are we going to get the rest of these people? And your attack, your approach has to change. It goes from being these mass sites. We were at the fairgrounds for 8 weeks. It goes from being these mass sites to more of a ground war, where you go into neighborhoods, you go to schools, you try to get the smaller numbers of pockets vaccinated. And a lot of people didn't understand that. They thought we should have started in the neighborhoods. But the problem is, at the beginning of any pandemic or any mass vaccination, you want to go where you can get the most individuals vaccinated, because that's how you stop the spread. And right now, what we're seeing is some continued spread. And the worry is that we're going to have that next variant that we will not have our vaccines work on. So what could potentially happen is we're going to have another variant out there that was able to get into somebody that wasn't vaccinated and mutate. That's why it's so important that we get as many people vaccinated as possible, as quickly as possible, to stop these variants. So let's just talk for a minute about hospitalizations. And I'm sure many of you may have heard our hospitalizations climbed. Our cases have climbed again in this last surge. We've been around 250, 200 cases a day. And then we're dropping back down into the hundreds. That's still too many. Our positivity rate is still about 11%. Any community that is successfully reopened and is able to sort of let COVID be in the rearview mirror, I think what we have is you start to see these, when you have COVID behind us, and we're starting to think about COVID being behind us, I think we have to start thinking about, this positivity rate is still 11%. And if we know it has to be between like 0.8 and 2 to successfully reopen, it's going to be tough when we're still at 11%. And our death rate is still up. Our death rate in the month of October, for the first 16 days, we had about 22 deaths. Back in January, we had about 48, 49 deaths a month. And back January, February earlier, we had about 200, 225. So our death numbers are still, they're itching back up again, which makes us still nervous because we still have a lot of community spread. I think we were so thrilled to get a vaccine that we really oversold it, like it was going to be this will be it. You don't have to worry. Well, that isn't exactly true. There isn't any vaccine that's 100%. And what we need to do now is, some people are going to have breakthrough infections. They just are. These vaccines were very, very, very effective. They were in the 80s, the 90s, percentage of effectiveness. For the flu shot on a good year is 50% effective. But they had waning immunities because it's a viral vaccine. But they just didn't know about them because they're new vaccines. The technology is not new, but fighting COVID is new. And so they were really, really different. When they there's clinical trials going on all the time. They're still assessing. They're still trying to make sure that this happens in an orderly fashion so that we can continue. All right. So if we go back, I was starting to talk a little bit about the hospital situation. Our hospitals have become crowded, and we have a lot of people in there. It used to be about 12% of our cases were under 18 years of age. Now we have about 20%. The majority of individuals hospitalized are still unvaccinated. Anywhere, if you look at the numbers around the state and within Summit County, somewhere up to 20% are vaccinated in the hospital, but they typically aren't the ones that are in ICU or ventilated, unless they have some severe underlying health conditions. And I think as of recent, everyone has heard about Colin Powell, unfortunately, that had some very significant health issues that probably made those vaccines not work as good. And so when you have those underlying health conditions and you become ill, that's when you have the problem. That is why, and I'm going to pivot here and go to boosters for a minute, because what has happened now is we've decided these immunities are starting to wane. The CDC and FDA, they're going to give a booster. of either Pfizer or Moderna. There is a certain group, however, individuals that had chemo, cancer, solid organ transplant that are eligible for the third dose. They're thinking now that individuals with certain diseases probably need a third dose. And so those will be ongoing, but the rest of us will be, if you meet the criteria, and the criteria is fairly easy to meet. It's individuals with any underlying health disease, obesity, BMI greater than 25, ever having been a smoker, high blood pressure, cardiovascular disease, autoimmune disease. There's any number of qualifying factors. And certainly if you're over 65 years of age and or living in long-term care and congregate living, you should definitely be vaccinated with a booster. And we'll just have to let it go on and see how long that continues. We are doing boosters. We have all 3 boosters. They're available at the health department. You can go online to get the shot at coronavirus.ohio.gov, and you can drive through and get your booster here. And or if you have trouble with the computer, you know folks that can't do it on the computer, we still have our phone bank open, and that's 330-926-5795 if anybody would like to get a booster and try to move there. We are still trying to get first doses as well. And if you know someone who has not had their first dose yet, we still have a limited number of gift cards. We're giving away $100 gift cards, a state incentive that was provided to us for somebody to get the vaccine. So we do have that as well for the first dose. So I will stop there, or I will talk all night, and I'm going to let, I'll be glad to stay and answer any questions. Thank you.
Thank you so much, Donna. And I think, Christine, go ahead.
All right, thank you, Donna. Really great information you shared. So appreciative of you and your team and all that you've done in our community and all that you've done with our community over at OpenM and the people in Summit County that we help daily. For those of you that don't know, Summit OpenM is located at 941 Princeton Street in the Summit Lake neighborhood. We service approximately 40,000 individuals and families throughout Summit County yearly. And our 3 pillars of service include our food pantry and our medical and dental clinic, which is free medical and dental clinic. And then we also have employment services. One of the things we noticed during the pandemic, and my tenure started in July, but being a lifelong resident of the city, very much aware of the fact that OpenM stayed open throughout the pandemic. And under the then leadership of interim director, Patricia Wicks, OpenM was able to be compliant with the CDC rules and regulations and not miss a beat. And in terms of not missing a beat, we needed to provide services specifically to those individuals who are reliant upon us for their medical maintenance plans, because all of us have read how, from a medical perspective, people put things off, put off getting prescriptions, put off seeing their primary care physicians during COVID because they were afraid to go out and about. And OpenM was able to continue their mission of providing medical care to our more than 400 active patients who utilize our services with primary care physicians that volunteer with us from SUMA, Cleveland Clinic, Western Reserve, and university hospitals. So we were able to keep those patients on their maintenance plans, with our 3 top areas being cholesterol, high blood pressure, and type 1 and type 2 diabetes. So those prescriptions continue to be filled. While we didn't have people actually coming inside for hands-on appointments, we did make that great pivot to telehealth. And who knew that telehealth would become so vital to maintaining people's health and wellness during this unprecedented time. In addition to that, with our employment services arm, we continue to serve those individuals in the community in need of jobs with benefits, in need of a way to care for their families. And with COVID, with that opportunity, there became opportunities for virtual work, things that people hadn't thought of. And with some of the CARES Act relief money, and with some, thoughtfulness on our part, on the board's part, on the part of OpenM, we started to provide better technology options for the individuals that we serve on that employment side of the house. We did find out a lot. We found out that just because you have a mobile phone doesn't mean you're connected, and that you can apply for jobs and schedule a vaccine and get things that you needed done. But we were able to provide those supports to those individuals in need. Last year, at the height of the pandemic, we still were able to provide unduplicated visits to the medical and dental side of the house so that people were well and able to go to work. Because it's if you don't feel good, if you're not on your maintenance plan, it's pretty challenging. We were able to find people jobs, upwards of 197 of our participants finding jobs and touching the lives of more than 300 children who rely on those heads of households to support them and provide them with much needed medical benefits. But I want to say, one of the most important things, and I'm trying to check the chat if there are any questions, but one of the most important things I think we learned, and that all of us learned, is we haven't been using technology to the full extent that it can be used. And now we're pushing it. We're thinking outside the box and using technology to the benefit of individuals in need. And there are those barriers, and there are those things that we need to think about in terms of making sure everyone has internet access. We've had the good fortune of having some great partners across the community. Spectrum providing some internet access for individuals and families at a lower rate, so that children can stay in school and work and learn remotely. Mom and dad can find jobs remotely and do those types of things. Mostly grateful for, I want to say someone had asked the question earlier about people being reluctant to be vaccinated. With the population of individuals that we serve, we did see a large number of reluctant people. And because of our partnership, specifically with Summit County Public Health, Cleveland Clinic, Akron General, SUMA, we were able to bridge that and come together as true partners, standing firmly, telling our community that this vaccine works and will keep you safe. And I just want to say, I'd be remiss if I didn't show my gratitude to Dr. Hart and to Dr. Devaney and to all those frontline people, Tracy Carter, all those frontline people that willingly came to OpenM for our cookout to help educate people in Summit Lake, people in Summit County, people in the greater Akron area on the benefits of the vaccine. And I have to believe and have faith in the fact that many of our reluctant individuals that waited a bit to get vaccinated, that they're going to be back for their booster, because they've seen the good work and the goodness that's come from being able to be out and about in the community, masked up, and having your children at school and at play safe. The other thing I just want to mention, a special thanks to Summit County Public Health and all the partners for the masks that you provided to OpenM, that we were able to get out to people in the community coming to Mountain of Food. You know, a lot of people took for granted that getting a mask was an easy thing. And, you know, in some families, we found some families only had one mask per person. And, you know, just the whole mask health piece, people didn't understand. You wash your mask. You know, we had fabric masks that people thought you could just wear them. And, you know, there was some mask education that had to take place. And the disposables were great and continue to be great to offer, but just really thankful for all those partners in the community that helped us get masks out to individuals and families. I think that's it from me for now, but just want to say thank you to all the partners and everyone in the community, and especially to, I want to say Judy Hill and the NAACP, what they did in the Summit Lake community and in Greater Akron was so beneficial and helpful in building the trust and getting people to understand the significance and the importance of being vaccinated and reaching out for help in whatever they needed in terms of wraparound services with OpenM and with other community partners right here in our city. Steve?
Thanks. I'm Steve McGarity. I'm the Executive Director at Community Legal Aid. If you're not familiar with us, we are a nonprofit law firm that provides free civil legal services to low-income residents in our community. We actually cover 8 counties. Summit County is our largest community we serve. We provide services to about 15,000 people throughout the 8 counties we serve. And I would say the pandemic confirmed for us at Legal Aid something that we had long suspected, and that's that the people who in our community who could at least afford to weather something like a global pandemic are often forced to pay the highest price. Sort of echoing what Donna was saying earlier. Every day we would talk to clients who were being asked to make really impossible choices. If they hadn't lost their job, it was typically a job where they were put at more risk, like working at a retail store, a grocery store, or some other public-facing service delivery work. If they had small children with daycares or the schools closed, what were they supposed to do with their kids when they're supposed to be at work? So they might be forced to leave their job. And then they try to get unemployment compensation and they're told, well, you voluntarily left your position, so now you don't qualify for unemployment compensation. And we just saw story after story like this early on in the pandemic. And then people would be without income, and then they couldn't afford their rent, and they couldn't afford food, and facing evictions and food insecurity. And had not been living in poverty, but had little savings to fall back on. And suddenly found themselves trying to negotiate complex public benefits programs and facing food insecurity, and now facing evictions for the first time in their lives, and having no idea how to go about getting the help they need to stop those terrible things from happening. And in the face of all that, we were really, what were we going to do? So the typical day-to-day work we were doing, going to court, representing people, the courts were shutting down. It was a really challenging time early on in the pandemic to figure out how to navigate this new system and this new problem. And we were really fortunate what were the most pressing legal needs of our clients. Our board of directors really also stepped up, and we jumped into sort of an emergency needs assessment to figure out what were the most pressing issues facing our clients. And the board adopted special priorities in response to COVID-19. So we provide services in a wide range of civil legal issues, basically anything that's not criminal. And we had to make some difficult choices pretty early on that we were going to not provide services in some areas that the community were expected us to provide services in order to meet the more pressing urgent needs coming out of the pandemic. And so the board adopted priorities that really focused our work on evictions, on public benefits, especially unemployment compensation and SNAP food stamp benefits. Domestic violence work continued to be a high priority. We had survivors of domestic violence who were in this awful situation during the quarantine of literally being trapped in their homes with their abusers and not able to get out, and trying to help them through that process with the help of the local shelters and all was great. And then finally, debt relief was another area where our experience in the last financial crisis really proved to be true, that people, even during good times, when they're low income, they tend to build up debt. And when everything falls apart, they can't afford to pay their debt and they start getting sued and wages garnished. And so we wanted to make sure that we had the resources to provide assistance to people facing debt. So what we stopped doing some assistance, like routine divorces. We were doing a lot of community development work. The attorneys that were specializing in that also happened to be experts at public benefits and housing. And so we put a hold on that work to give them a chance to bone up their skills and get into court to represent people in those matters. The change in our requests for assistance was pretty dramatic. In the first few months of the pandemic, we had a 400% increase in requests for help with unemployment compensation. And unemployment compensation itself, the entire system was changed because new forms of unemployment compensation were added and new benefits were made. We provided assistance to a teacher who was forced to not work because of health concerns, and was denied benefits, and had to work with him. And again, someone who had never really imagined themselves being poor, suddenly finding themselves with a child at home and no income and unable to work, making sure they got access to some of the special public unemployment compensation benefits that were available to people in these unusual circumstances. We saw over a 200% increase in requests for evictions. For much of the pandemic, there was a moratorium issued by the CDC that prevented most evictions from happening, but that didn't go into effect for months after the start of the pandemic. And it was a mad scramble in Summit County, as well as all the other counties we serve, to navigate the balance between the incredible health risk that exists for kicking people out of their homes versus the efficiencies of the court system and the rights of the landlords, and trying to convince the courts that people, in the middle of a global pandemic, to kick people out onto the street was going to do nothing except spread disease and make the situation worse. And while we certainly, we obviously are advocating for the tenants, and we feel for the landlords, but landlords, like any business owner, were faced with difficult choices and economic impact of the pandemic. And we couldn't carve out some special rights for them while everybody else was suffering. And that was a real struggle in many of our courts with many of our judges to convince them to let people stay in their homes. And then thankfully the CDC moratorium went into effect, and that issue was fortunately resolved. That didn't necessarily stop evictions from happening. What it meant was that landlords had to become more creative in how they were going to try to get their tenants out. And so we really had to redouble our efforts to be on guard against some of the more, they couldn't be evicted for non-payment of rent if the tenants had been infected by the pandemic, but they could be evicted for all sorts of other things, like minor violations of leases and stuff like that. So we really had to be on guard and have more staff available to protect tenants in situations like that. We've talked about the use of technology, and legal aid was no different. I mean, we've always used technology sort of in the back end of our system to make things run efficiently and to manage the large case volume we have, but in terms of our day-to-day work with our clients, we were a typical law office that, we use phones and fax machines and email, and that was sort of the extent of it. And the pandemic really, we were an organization that did shut down to the public, but we still needed to provide the services to the public. And so we had the infrastructure in place, fortunately, that we could provide services to people remotely. Courts were great in that they started using online hearings for routine cases. And I think moving forward, hopefully that will continue, because it is a lot more convenient to attend a hearing remotely than having to drive down to the courthouse for a 20-minute hearing. But things like the even just meeting with clients and meeting them in person, that in the sort of strange way, here we are talking on Zoom. We've all sort of adapted to that, and the ability to communicate effectively, I think, over Zoom and video conference has changed dramatically. That our attorneys now regularly meet with clients over Zoom, and I think have as effective a relationship as they would if they were in person in most cases. It doesn't work in every case, but it really opens up for us, the geography of our staff. We have staff in Akron, Canton, Youngstown, and Warren. And if we have a client in Akron who needs help, but all the Akron attorneys are busy and the Youngstown attorney isn't busy, well, before the pandemic, we would say, sorry, we can't help you. Now we can have the Youngstown attorney just connect with that client over Zoom and provide those services. And so we think it's been great. Another area for legal aid that's changed a lot is how we engage in community education. We were doing a lot of outreach in the community, and we would get excited when we would have a room of 15 people to be able to tell them about how to protect their legal rights, and mark it as a success. When we had to cancel all that because of the pandemic, and almost immediately, we started every Wednesday evening at 5 doing a Facebook Live event. Not really sure what would happen, but I think the first one we did was on evictions, and by the end of the second or third day, we had 2,000 or 3,000 views, which for us was like a miracle. That like we had found this way to connect with all these people and get them this really important information. And Facebook Live is such a great interface, because the clients can go on and type in questions into the chat, and we can provide answers, and we obviously moderate that. So it turned out to be great. And so we just started doing it every week. Some of our most popular ones were around unemployment compensation. You can imagine, I think one of them had over 10,000 views within a few days. Education related issues, especially for kids with disabilities, and how parents can navigate their rights as parents in the education system during the shutdown. And this is something we did because of the pandemic, but we have no intention of ending it when the pandemic ends. We might step back a little and do it, twice a month instead of every week. But we just found it to be just an incredibly effective way to get a lot of really good information out to people quickly. Other things we've done using technology is like with the Goodyear Legal Department. Before the pandemic, we had been working with them to launch a record sealing clinic where they would help people seal their criminal records. And then the pandemic hit, and we weren't sure what to do, but we used Zoom to do it. And suddenly, instead of them helping 5 or 6 people in the Akron area where they were located, they could now help 15, 20 people in a month over Zoom in all 8 counties we serve. So places like Wayne County or Columbia County, where it's much harder to get out to, we could provide the same level of service to them because of the technology. I will point out one real success story here in Summit County, and that was the Summit Cares Eviction Prevention Program. We partnered with the Department of Jobs and Family Services, United Way, Community Action, the Domestic Violence Shelter, Fair Housing, and others, to really come together to figure out a way to connect the tenants with the rental assistance money that was available, because there's millions and millions of dollars of rental assistance dollars available to tenants. And across the country, you hear stories about how that money, it's not being placed. The tenants aren't getting it because there's so many hoops to jump through. And the partnership here in Summit County really made it possible to get that money out the door in a way that did not happen certainly in any of the other counties that we serve to the same extent. And our job at Legal Aid was, of course, when the landlord said no, was to say, well, we're going to make an offer you can't refuse. And so to try to get them to do it, or to make it very difficult for them to evict the tenant in court. And so it was a great partnership from the start to finish, and a real testament to the incredible collaborative nature of Summit County. I think I'll stop there. So as we're approaching.
Thanks so much, Steve, Christine, and Donna. We appreciate the updates. I do have a few questions from our audience. Donna, one of the first ones that came up was, are you expecting to have the COVID booster shots become like an annual occurrence? And is COVID-19 here to stay like the flu? What are your thoughts on that? And you're muted.
I told you,
Yep.
I will never not do this right. Okay. Actually, SARS-CoV-2 is a novel coronavirus. And I don't think, unless we get to a very high percentage of vaccine, but I still think it will circulate. We, around the world, we only have about 23% of the world's population vaccinated. People can fly around the world in about a day. I mean, so as long as we have travel all over the United States, travel in the world, without a large percentage of the world's population vaccinated, COVID will never go away. Do I think it will become? I would think that probably Moderna is working on a combination flu COVID vaccine to be used. But I think what might happen is might get like the flu vaccine eventually, where you will get one every year. But as clinical trials evolve and as they learn more about the vaccines and how well they work and what the long-term immunity might be, but eventually, knowing that it's a viral vaccine, you will most likely have to get a booster. There probably will be a very small chance you would get lifetime immunity. I know there's a clinical trial going on right now looking at if you've had COVID and the vaccine, the full series, are you protected for life? So they're looking at how much your antibodies wane and the levels of the antibody. So, I mean, that's the problem with people who get COVID. They have natural immunity, which affects one part of their immune system, but you still need the vaccine to do the other part. And so folks think, oh, I had it, I'm good to go. CDC says you're only good for about 90 days. So even if you've had the vaccine, you need, and even if you've had the COVID actual disease, you still need to get a vaccine.
Great, thanks, Donna. This question is for the whole panel. What suggestions do you have to encourage individuals who live in congregate housing to get the vaccine if they're adamant about not getting it? Any recommendations or suggestions?
I had put into the chat basically that I think we've had most luck when we're sitting with somebody, and literally it's a one-on-one, answering their questions and not judging. People have very deep-seated feelings, and you have to be respectful. Some of it's based on misinformation. There's a ton of misinformation out there. But I think a lot of it is just respecting a person where they're at and answering their questions. Our medical director has been very successful at sitting with individuals and just talking to them about the risk, and then being able to convince them to get the vaccine. So I think it's that respect with no judgment, and then really trying to tell them about the community good, that it's for everybody. And from where we sit, we've seen awful things happen from COVID-19. So we tell everybody to take it.
Just to add on to Donna's comments, I know at OpenM when we have our clinic evenings or when we're doing a mountain of food distribution, we make sure we have the literature available from our partners, from our hospital partners, from Summit County Public Health. And when people have questions, and our health services managers there, and she'll talk to them and tell them, give them the facts on COVID vaccine. And when people ask, have you been vaccinated, Christine, and how did you feel afterwards, and do you know anyone that's had COVID that also had the vaccine? Just being very honest with those answers. And like Donna said, without judgment, because people are afraid. I mean, people are afraid to get shots. And just being honest, I had a woman that we saw every month for 3 months. And when the SUMA Vaxmobile was on site, she got out of her car, and I watched her slowly inch her way from the other side of the parking lot to get her vaccine. And she's like, I've seen them here a couple times. And I know that they care about the community, and I know they care about the mission of OpenM, and that you wouldn't have someone here you didn't trust to help us. So knowing that we trust each other and that we're working collaboratively for the greater good is essential, and makes a big difference for the individuals that that we're striving to keep healthy as we move toward herd immunity.
Donna, do you have any information or any thoughts on school mandating the COVID-19 vaccine shot as other vaccines?
Yeah, I'm not sure. Right now, they do not mandate the flu shot. So I don't know if they would go to a COVID vaccine or not. Children 6 months in age of older are eligible for a flu shot. But they do clearly mandate the MMR, measles, mumps, rubella, Tdap. There's things they do because of whooping cough and some other issues. They do mandate those vaccines. I think it'll be a while before we see COVID or flu mandated.
Steve, this question is for you. Is there anything more that the community can do or funders can do for residents such as those living in Hillwood, Rosemary, living in deplorable conditions?
Yeah, so this is an issue that got some public attention recently with an article in the Beacon Journal and the Devil Strip about our work to help organize tenant unions at some housing developments here in Akron who are living in really terrible conditions. I think for us, the biggest challenge is having the staff to do sort of the day-to-day work on behalf of people. So we can go in and talk to people about their rights, but when push comes to shove, if you're really going to force landlords to make change, it's probably going to require representing a lot of people in court in conditions cases. And from the legal aid's perspective, that's always been a challenge because those cases are complex and take a long time. And in the myriad of the kinds of work we do, we've been less focused on that. Trying to keep people in homes was the challenge in and of itself. So, I mean, the more support we have in the community for enforcing already existing building standards, I think any member of the community can speak about that. The funders certainly supporting legal aid in helping us represent more people in these actions or other organizations that we're working with, like Fair Housing and Freedom Block, I think would obviously be welcome. And I think housing is an area that we tend to focus a lot on homelessness and which is obviously important. And we really neglect huge swaths of our city that are just awful places. I mean, that they're really difficult places to live in because of the conditions of those homes. And they're almost all rental housing. And they're almost all the result of historical redlining is what happened in those communities. And so I think for us as a community, coming together to try to address that is really important.
Thanks, Steve. I think this one's going back to you, Donna. So one of our attendees mentions that Moderna was suspended in some European countries, and now there's a conversation about Moderna not being safe. Does that play into the booster for people who are already vaccinated? What thoughts do you have on that?
Yeah, as you know, all vaccine is not without risk. Even your flu shot you take is not without risk. And each of these vaccine in a variety of countries, and like J&J was yanked in here in March because of thrombocytopenia in a group of individuals, particularly women under 40 years of age. And so it was put back on the market again. I suspect Moderna will be back on the market again. The United States has not felt that same issue and wanted to suspend Moderna. We will be administering Moderna booster shots. And so I think it's perfectly safe. I think all of them, an mRNA vaccine has the risk of some cardiac involvement. The cases have been so few and far between. Johnson & Johnson has had the risk of some thrombocytopenia, and probably the bigger problem with blood clots, this TTP that develops, was that when it was first developing in people, it's very unusual to have blood clots and too few platelets. So they had, all these very few platelets, but then they had these blood clots. So they treat with heparin, a blood thinner, which made it worse. And so those people passed away because the treatment wasn't appropriate. Today, there is treatment for an adverse vaccine reaction. I can tell you at the fairground and here, we've probably administered a good 70,000 vaccines. And we have seen very few reactions. I have seen far more people pass out because they hated needles than any other reason. I never knew how much people hated needles until we started doing the mass vax. So I think they're all safe. I think that it's closely monitored. I think the VAERS system, the Vaccine Adverse Event Reporting System, is very closely looked at. And that's how they were able to pick up the J&J problem. And so I think we have to have confidence in this because it's like all medical procedures. Nothing is without risk.
Donna, this is another question for you. What do case levels need to be in Summit County for public health to drop the current mask wearing recommendation? How far are we from that?
Yeah, we look for positivity rates, like I said, between 0.8 and 2 that looks at successful reopening. People always ask me, oh, you still wear a mask everywhere? I'm like, yeah, because I really liked not having a cold last year. I really, really loved it. And I do believe that helps keep you safe from all bugs that are out there. So I was really, really happy to not have that. But I think, we're looking at our case count is still about 230 per 100,000. And the governor had originally said we have to get below 50 per 100,000. So we would like to see it get as close to 0 per 100,000 as we can. But I don't think that's realistic. So I would say that positivity rate 0.8 to 2% and or having cases that are dropped down to about 50 per 100,000.
Christina, maybe time for one more.
Yes, maybe time for one more. Okay, so how is contact tracing being managed at the schools? And what do numbers for positive COVID cases look like right now in Summit County within our schools?
Okay, some schools are masked, some aren't. So there's 4 school districts that aren't masked. And so the ones that are masked have much lower case counts and quarantines. How contact tracing is managed right now at the schools is a positive case is reported to us and or the parent reports it to a school. They then look at the persons who were in the close proximity of that individual within 6 feet. They then look at vaccinations data. If they were vaccinated and masked, they can stay in school. If they weren't vaccinated, they have to go home for the 14 days or 10 days, whatever the school permits with testing. However, yesterday they changed the quarantine requirements in Summit County. Now schools are allowed children who have been exposed to stay in school as a contact, whether they're vaccinated or not, but they have to wear a mask. And they're calling it mask to stay, meaning stay in school And then if they want to play sports, they test to play. So they have to have a test the day that they are exposed. 3 to 5 days later, they have to have another test. And if they're negative on day 8, they can come out of quarantine. So they're trying to work a way to keep more kids in school. We had kids missing way too many schools, too many school days. And kids had a really rough year last year. They can't take another really rough year this year. And so I think they really felt as though that it's so widespread, and children do seem to get the sniffles and cold. And I'm not going to say some kids don't get really sick. Some kids do. But for the most part, they don't have the symptoms. And so these kids out of school, when what we were finding is those children that were out on quarantine because they were a contact had about a 4 to 6% conversion rate. So they weren't really getting that sick from it. So and they did the Warren County study, which allowed these kids to stay in school, and they haven't seen a big increase, nor has Medina, nor Lorain County. So we're hopeful that this will leave more kids in school, but we still manage all of the isolation and quarantine.
Thank you, Donna. And I think this one more question, because I think it's important to reach a targeted population, and that is the elderly. And Matt Reed, I know you're on the line. If you could unmute, if you're able to, and maybe chime in. But the question is about seniors, and many of them are reluctant or don't have online services. What is the outreach to them? And Matt, are you there that you're able to talk about what Direction Home has done?
I don't think he can use his mic because he's a attendee. Sorry, John,
Okay.
but he can message in.
But Tracy, Direction Home Akron Canton is our partner in working with the aging seniors. I know they've done a lot of outreach to the community, especially when it comes to seniors. So I would encourage you, if you have questions, reach out to Matt and that organization, because they are experts in that field. So with that, Christina.
Yeah, well, I think I would like to give an opportunity for Christine, since she had a success story in terms of reaching to one of her clients. Christine, any quick tidbits as to how we get there?
I'm sorry, in terms of technology, the technology?
No, well, in technology, but also in terms of reaching our elderly population, making sure that they can get vaccinated.
Well, okay, I'm sorry. With vaccinating our seniors, I mean, my really great story is my uncle, who is 80, refused to get the vaccine, and has been homebound since March of 2020. And he saw, and his daughter is like a sister to me, and we talked about it. And she's like, well, you know how Dad is. Well, he saw the article that Betty Lynn Fisher did about vaccinations and the cookout at OpenM, and many of our participants stopping by and getting vaccinated, even though they were part of the group of people that said they'd never get vaccinated. And he called me. Well, he actually called my mom and said, hey, I want to talk to my niece. So I went to his house. Now, he hasn't seen anyone or let anybody in. I went to his house, and before I went, I called Donna Skoda and asked for the dates and times, because he wanted Moderna, and it was a Tuesday. So that Wednesday, I got him scheduled to go over, didn't have to schedule, to be in line in the morning to get the Moderna vaccine. And just, told him the benefits of being vaccinated. And he's happy to be out and about and masked up and being able to visit family now because he got the vaccine. And it was all about just reading a story in the paper and hearing that other people are afraid and that they're okay now. And he's just called the other day and is looking forward to getting his booster. So we're excited and grateful. And he fortunately is a healthy 80, doesn't have underlying conditions, had no symptoms or anything. And again, like the one person mentioned in the chat, it's about trusting and having someone you can talk to that's going to share their story and encourage you and build up that trust in the community.
Fantastic. Well, we want to thank you all again so much for sharing the information with us, for being here with us, and of course, for the work that you have done through the pandemic to serve our communities, to keep Summit County going, healthy and thriving. And for our attendees, thank you for being here. Thank you for logging on. We will be having our education community issue session at the end of January. We'll make sure we share information in terms of whether it'll be in virtual or in person. So please keep an eye out for our emails and feel free to reach out to any of us with questions, or if you'd like for us to provide additional information on anything discussed today. We'll get you connected. And with that, thank you, everyone. Have a great night, and we'll see you next time.
Thanks, everyone.